Formally, I guess we can start now. On behalf of SDPI, I welcome you all to the session on impact of COVID on food security with the focus on challenges for women. This is the collaboration with the Netherlands Embassy in Pakistan. Today, we are joined by Mr. Wouter, Plomp, Ambassador of the Kingdom of Netherlands to Pakistan. With the with the experience of over 3 decades, he worked in Embassy of the Kingdom of Netherlands in Warsaw, Prague, and some other countries at various positions. And currently, as Ambassador of the Kingdom of Netherlands, he served in Benin, and currently he is his Ambassador of Netherlands to Pakistan. We are also joined by the Miss Androulla Kaminara. She is Ambassador of the EU to Pakistan. She is an experienced EU official with a career of over 2 decades in a European Commission and in the European External Action Service. We are also joined by Dr. Aamer Irshad. He is a leading expert on agricultural development and food security, and during his 20 years development career, he worked with several national and international organizations, both in private as well as public sector. And currently, he is associated with FAO as head of programs. We will be joined by Dr. Pauline. She is a research fellow at the Institute of Development Studies. She has 20 years of international experience in research on gender and humanitarian responses. And we are also joined by Dr. Aneela Afzal. She is assistant professor at Arid Agriculture University. She will be sharing her experience on gender-related issues with respect to the food security. And I also welcome our representation from the Ministry of Food Security, Mr. Rashid Mehmood. He is Additional Secretary, Development and International Coordination, Ministry of National Food Security and Research, Government of Pakistan. So, may I request all the speakers to keep their microphones off when they are not speaking, and speakers are also encouraged to switch on their cameras, especially when they are speaking. The seminar will be recorded and the video will be posted online. You are welcome to revisit the discussion later on, and we also invite questions from our audience and colleagues at the end or during the session. Please feel free to write them in the chat box on your right side. And the session will also be telecasted live on the Facebook page of SDPI. And for those watching us on Facebook Live, please write your questions in chat there. The session will be moderated by the Executive Director, SDPI, Dr. Abid Suleri. He has over 2 decades of experience of working in development sector, and he has tracked record of high-level policy engagement and evidence brokering at national and international level. He is a member of various policy level committees, including Prime Minister's National Economic Advisory Council and ESC's Subcommittee on Food Security and Agriculture, and also Food Security Advisory Council established by the Government of Pakistan for COVID-19 response. Thank you again, all of the speakers and attendees to joining us today. And now the session is handed over to Dr. Abid. Thank you.
Well, thank you, Rabia, and let me also welcome Dr. Oosterhoff. Good morning, Dr. Oosterhoff, and thanks for making yourself available for this very important discussion. So, ladies and gentlemen, as my colleague Rabia, she already introduced that we are discussing 3 very important subjects which in their own capacity require a full panel. We are talking of impact of COVID, we are talking of food security, and we are talking of impact of both COVID as well as food insecurity to women. How it is increasing the challenge for women, the COVID-induced food insecurities and food insecurity related aggravated impacts of COVID. If the body is not healthy and if the body is have less immunity, compromised immunity due to food insecurity, how the person can remain resilient to COVID. So all of these 3 things, this tri-dimensional subject would be discussed by very eminent panel, as was introduced by Rabia. But to begin the discussion, I would request my colleagues to broadcast the video message by Excellency Mr. Wouter Plomp, who is Ambassador of the Kingdom of Netherlands to Pakistan. He couldn't join us virtually, but of course the Dutch government's dedication towards this subject, he sent us a recorded message. Here I should also mention that Honorable Federal Minister for Food Security and Research, Fakhr Imam Saab, he had to join us, but he is recovering from COVID. He is still in quarantine. So he, despite his best efforts, he couldn't make it. I welcome Mr. Rashid Mehmood, Additional Secretary for the Ministry, who joined us on his behalf. So if we can broadcast the message of the Honorable Ambassador of Netherlands.
Assalamu alaikum. I'm very glad to speak today at this panel session on impact of COVID on food security and challenges for women, as the Netherlands Embassy is a proud partner of this meeting. Because of climate change, poor harvest and population growth, the danger of famine is increasing all over the world. And Pakistan is especially vulnerable to these threats. Already in normal situation, 40 million people, 40 million people, face food insecurity in Pakistan. COVID-19 has added another 2.5 million to them. And women are especially in dire straits, as women face disparity in terms of food consumption, and in fact 1 in 7 women of reproductive age in Pakistan is undernourished, and many face zinc deficiency. In response to these challenges, the Netherlands works to boost food security, sustainable agriculture, and effective water management. For example, Netherlands supports GAIN, the Global Alliance for Improved Nutrition. They are doing a project on large-scale food fortification, focusing on women and children. GAIN is also working on keeping food markets working to protect and sustain food systems in the face of COVID-19. Finally, the Embassy of the Netherlands has set up a potato capacity building project in 4 districts of Punjab to train potato growers on techniques to improve quality and quantity of production. And also this project will focus on the role of women. I wish you a very fruitful discussion. Bahut shukriya.
Well, we appreciate the message by Excellency Ambassador of Netherlands, and the way he highlighted how COVID is negatively impacting women. And of course, already the existing state of food insecurity in Pakistan. I'm sure that the presenters, they would be alluding to this fact. Now, may I request Honorable Excellency Androulla Kaminara, Ambassador of the EU to Pakistan, for her remarks, and then we will go for our informal discussion and the presentation. And I would request Rashid Mehmood Saab to chair the session and give his concluding remarks towards it. Over to you, Excellency.
Thank you very much, Dr. Abid. It's a pleasure to be part of this 23rd Sustainable Development Conference with SDPI, which is co-organized by the Dutch Embassy in Islamabad. Let me start by an obvious statement to put things into context, that we have to recognize that despite of having food surplus in Pakistan, there is increasingly food insecurity, not because there is food production shortages, but because the problem of access to food is, and due to lack of purchasing power. The food exists, but the people don't have sufficient funds to buy it. Economic inequalities and a high inflation in food prices is making food inaccessible to a large segment of the population. I would like to focus on 5 different things. The first one is COVID-19 aggravates already a critical levels of food insecurity in the country. So COVID-19 has come to aggravate an already chronically critical food insecure situation. According to the latest National Nutrition Survey, 44% of children under 5 were stunted in 2018, and 37% of the population of Pakistan was facing food insecurity. The data is not exactly double cross, but we can safely say that that makes 40 to 60% million people were food insecure pre-COVID. Now, behind these percentages and behind these figures, also there's another story which basically says about inequalities of food insecurity throughout the country. This is not the same throughout the country. For example, in some districts in Sindh and Balochistan, the figures are really, really worrisome. In Tharparkar and Umerkot, which are basically located in the worst drought-prone areas in the country, where the EU is currently implementing a 3 million food security project in collaboration with FAO. 60% of the population, or 1 million people, were in 2019 in a situation of crisis or emergency in terms of food security. Which brings me to my second point. The main driver behind food insecurity is poverty. Extreme poverty is the main driver of this disturbing data. The multidimensional poverty index for Pakistan, which captures the 3 main deprivation indicators, that's education, health, and living standards, show that in 2017-2018, 38% of the country's population was deprived in one of those areas, in health and education and in living standards. And poverty rate in terms of daily income declined, however, from 2013-2014, where it was around 29%, to 24% in 2015-2016. These are definitely good news. But again, if you look at behind the figures and the percentages, that means that around 50 million people back then were still living below the national poverty line. Since then, poverty reduction pace has decelerated due to, on the one hand, economic issues, and on the other hand, lack of redistribution policies, as well as the impact of COVID. And of course, being poor means that you're on the edge of the cliff. With the slightest shock, then you fall. So basically, with the corona crisis, pushed a lot of people into the poverty, into further poverty, and it is estimated, again, the figures are not fully accurate, but order of magnitude, about 10 million people are expected to enter the poverty range due to the pandemic. So the third point I'd like to make is that poverty and malnutrition can come hand in hand. So malnutrition is a multidimensional and intersectional phenomenon. The intersections of class, poverty, gender, religion determine the nutritional status of people in Pakistan, and I would also say this is true for most places in the world. Women face specific nutrition-related challenges that take a heavy toll on the whole society. Children of malnourished women are more likely to face cognitive impairments. They are more likely to be short in stature, they're lower resistance to infections, and a higher risk of disease and death throughout their lives. The more children each woman has, the higher the risk for a malnourished mother, and therefore the bigger the risk for health problems of the children. Again, poverty and malnutrition come hand in hand. Micronutrient deficiencies, which affect particularly pregnant and lactating women, are strongly strongly correlated with GDP per capita. And current projections predict a global GDP decline of 10% due to COVID. The figures for Pakistan are from the GDP growth of 3 to 4%. Until recently, next year, it's expected to go into a shrinking of the economy from 0.2% to -2%. Immediate responses are required to address malnutrition among women. Solutions do exist. It's well known that the number of nutrition-specific measures, such as maternal dietary supplementation, micronutrient supplementation, or breastfeeding and complementary feeding, lead to a proven positive impacts. In that sense, allow me to highlight how important it was for me to see that our support to the government of Sindh through our 60 million flagship nutrition program in the province has contributed decisively to ensure that 262 nutrition stabilization centers in 8 districts have kept running during these COVID times. It is estimated that about 70,000 children under 5 will be treated for the malnutrition, 70,000 per year. So that's a very large number of kids, but of course, a lot more needs to be done. This brings me to my 4th point on the efforts that the government has been doing and the need to recognize those. The government has been making extraordinary effort to palliate the negative impact of COVID for the most vulnerable. Something like 1.25 trillion Pakistani rupees have been spent to provide relief with a focus on daily wage workers and laborers through existing social protection systems. These have been implemented through the SRS program, but also other initiatives have contributed in this objective. Also, the international community has shown its commitment to contribute to tackle the immediate effects of the pandemic. We all know that these efforts need to be stepped up and the structural causes to be addressed. The main challenge remains the same as before COVID-19, and it's a common challenge for both men and women. How to accelerate poverty eradication and provide fair economic opportunities to all, and we need to recognize that there is not a single answer to that. Another example is in the province of Sindh, where the EU is presently supporting a portfolio of a total amount of 192 million euros. Together with the government of Sindh, we're implementing with partners programs that are trying to devise ways to provide support to the 76% of the rural population in the province who are uneducated, landless laborers, and their families, in many cases bonded by debt. And we should recognize that this is not easy to really tackle the root causes without a comprehensive response. Which brings me to my final point, way forward. I believe we need to work together to devise policy responses to combat poverty and inequality leading to food insecurity. Policies need to be fully implemented, policies that are monitored with proper figures reflecting the real situation in real time, including systematized gender analysis and sex and age disaggregated data collection in order to fully be accountable for the concrete results achieved. Of course, the data has to take fully on board gender disaggregated data. Policies need to focus on the most vulnerable groups and trigger more significant structural changes. And the policies actually have to take into account both men and women roles, because of course they're different, so as to ensure that their multiple and differentiated needs are adequately addressed. Thank you for your attention, Bahut Shukriya.
Thank you, Excellency, for setting the scene, especially highlighting that it's not only the availability issue that is posing a challenge for food security in Pakistan. It is about socioeconomic access, and of course, it's about clean drinking water and sanitation as well. And thanks for also highlighting the importance of gender segregated data. Of course, gendered policies can only be truly implemented and effectively tailored if we have a gender segregated data, and if we try to understand the impact of food insecurity and malnutrition on girl children and on women and other segments of population, trying to see their demographic segregation. Now, in order to do some further discussion on the topic, I'll request Dr. Aamer Irshad to share the findings of FAO's latest research with us, and Dr. Aamer Irshad would be touching upon this very subject. So let's try to see that how FAO is actually has collected some evidences about impact of COVID on food security and challenge for women, and then we'll take this discussion further. Aamer Saab is head of program of FAO in Pakistan. Aamer Saab, you have around 10 minutes, please. So I'd suggest you to focus more on policy recommendation after showing your initial slides. That would help the panelists to then be able to discuss your findings in detail. Thank you.
Thank you, Suleri Saab. Can you see my slides and can you hear me well? Yeah, thank you, Suleri Saab and Excellencies, ladies and gentlemen. Good afternoon and Assalamu alaikum. So let me thank SDPI for inviting me to represent FAO in this conference, and I would also like to appreciate SDPI for continuing its good work for not only creation of knowledge but also sharing of knowledge even under this COVID situation. So before going into the detail, I think that it is very important to understand the situation before going into the detail around the topic of discussion. As you know, and as the Excellency Ambassador, European Union has mentioned that, I mean, we are going through a situation that is not peculiar to only Pakistan. That is a kind of global phenomena, and all the global economies, they are kind of not in a good shape. I mean, some economies, they are suffering even 10% negative growth rate, but overall global growth would be this 4%, and that would be the lowest in the last 70 years. So Pakistan, as being important member of the global economy, has also suffered and is also suffering because of this COVID situation. And in the last fiscal year, Pakistan growth rate was negative 0.4%. And the impact on food security and ability of the people to buy the food has been suffered and has been suffering, as you know, especially for the poor household, which are already struggling with the tight budgets, and they are spending, as you know, in Pakistan, around 50% of their income on buying food. So in this constrained situation, they will be left with no choice but to release their stock in the market and to buy other important items for their, the daily life activities. So that is a kind of impact. And then with regard to food production, the supply chains in Pakistan has been disrupted, and I think people who themselves are buying household and food items, they must be experienced the situation. I mean, I would say I will tell you the example of egg. I mean, last year that was 100 rupees per dozen, but this year it has already gone over 200 rupees per dozen. So you can see the situation with regard to fruits, vegetable, and poultry. And the bad weather in Pakistan has actually added and further worsened the situation because our production area, especially with regard to vegetable, that has been suffered, and the country has been experiencing like escalation in food inflation and food prices. And at the end, I mean, the women already having problem in Pakistan, I mean, country like Pakistan, and this situation, COVID situation, will further make the situation bad. With regard to food security, prevalence of food security, I think that the country has been able to bring by 9 percentage point in the last 20 years food insecurity in the country. And now the question is whether Pakistan would be able to continue the momentum or not in this COVID situation. Poverty, as again ambassador has mentioned, that is very important indicator. And similarly, on poverty front, Pakistan been able to reduce poverty substantially, and with the achievement in both poverty and food security, Pakistan almost was ready to introduce reform in the food sector. But because of this situation, it seems that uh, the reform process is further delayed in Pakistan, maybe a couple of years. The situation of food supplies in the market, I would say that Pakistan is not self-sufficient with regard to food availability. I mean, if I tell you the trade balance with regard to food, we are exporting less than $5 billion, and we are importing more than $5 billion worth of food items every year in Pakistan, and that makes Pakistan a little bit food security vulnerable. And you can see from the graph or from the figure that with regard to five commodity, Pakistan is struggling, but Pakistan is self-sufficient with regard to some commodities, but those are not sufficient, and that makes only 10 or 20% of our food supplies. And this quick information with regard to this year food supplies and production in the country, you can see that wheat, sugar, gram surplus, and tomato are in short supply, and Pakistan is trying to import and trying to make food available in the country. This graph shows, I mean, the base starting from January, and you can see that the food prices has been going up continuously. I mean, that is a kind of a trend, and that trend is still going on. I would say that is not only because of the COVID, but there are other several reasons, as I mentioned, like the bad weather in Sindh and in southern Punjab. You see food inflation year and year basis, and you can see that the food inflation is higher in rural areas in Pakistan compared to the urban areas. And there are several reasons mentioned on the left side. I would not go into the detail, but the cost of production, the bad weather, the short supplies in the market, and dependence on import are one of the important reasons for food inflation in the country. Hotspots in food system of Pakistan, climate change, I think is the biggest item. And I think everybody knows that Pakistan is at very high at the vulnerability index. I mean, in the last 2 years, Pakistan has jumped from number 7 to number 5 position. So you can see that how the situation is bad with regard to climate change. Although the country, the government, the public sector, private sector are struggling, are trying to provide technologies and imports and injecting money in the agriculture sector, but the growth rate of agriculture sector is continuously going down. Sustainable natural resource again is the issue. How we are using our land and water resources is a hotspot in my understanding. Food loss and waste, agriculture productivity is not good. Whatever we are achieving with regard to agriculture growth rate, that is only coming because of the injection of money or injection of resources. That is not coming because of the technology injection. Food marketing and logistic is a big issue, and you have seen that the logistic supplies have been disrupted in COVID situation. And the last point that relates to the utilization dimension of food security, the that is actually bad, and that covers the nutrition situation and wash and other kind of issues, and that also covers the gender issue with regard to children and women as well. Coming very specific to the women issues under this COVID situation, and I will focus my talk towards the rural woman, as that is a prime kind of focus of the FAO as an organization. And although the COVID-19 pandemic is obviously a health crisis, it is also a food security and economic crisis that affects men and women differently. As COVID-19 continues to spread, women in agriculture are struggling to cope not only with the restrictions to limit transmission of the virus, but also with endemic gender inequalities, which undermine their capacity to respond and recover from the impact of this pandemic. Already before COVID, the rural women everywhere faced major socioeconomic challenges. Generally, rural women encounter greater obstacles than men in access to productive resources, assets, services, technologies, markets, and social protection. Because of their workloads and multiple roles and resulting relative lack of time and mobility, rural women are overrepresented in the informal sector and among the poor. Furthermore, cultural and legal constraints often limit women's ability to participate in decision making within rural institutions and in policy process. So after COVID, I would say the COVID-19 crisis is adding the already existing structural inequalities, increasing the burden on women as they struggle to fulfill their multiple roles. Rigorous information on the gender specific impacts of COVID-19 would come from rapid assessments, which are currently going on. But many such surveys are still in progress, and so robust statistics or information are yet not available. From the limited information that exists with the FAO, we can conclude that the COVID-19 pandemic reduces the economic opportunities for rural women, and the FAO actually has data on each, the items that I am presenting. The COVID has worsened women's and girls' access to nutritious, safe food. It added women's unpaid care work and the unequal division of labor within household as COVID-19 response measures close schools, public spaces, or care services. Also, gender-based violence has increased during the COVID-19 crisis as lockdown and self-isolation measures increases stress and economic hardship. You can see that the UNDP actually COVID-19 global gender response tracker includes over 2,500 measures across 206 countries and territories in order to monitor policy measures to identify the responses. And the finding from the tracker shows that while set most governments are attempting to mitigate the economic impact on low income groups, a gender lens is seldom applied in national response plans. Therefore, it is not clear if the COVID-19 response will reach rural women and other marginalized groups. Some measures could even have a discriminatory effect, for example, by exposing women to risk of overwork or gender-based violence as a result of inter-house tensions. Since only few countries have explicitly addressed the economic effect of COVID-19 on women in the response, it seems that further gender-sensitive measures will be necessary. For national response to have the necessary impact, they must account for rural women concern. And this is not just about rectifying long-standing inequalities, but also about building a more just and resilient world. So to address the lack of gender consideration in COVID-19 response plan, FAO advocates for urgent action in 5 key areas. And that is number 1, we recommend that the countries need to design an implementation of gender sensitive social protections. We suggest that there's a need to support the productive capacity of women farmers. We advocate that there's a need to adopt special measures to support rural economic activities in the agriculture food value chains. And there is a need to adopt programmatic and policy oriented measures to address gender-based violence. And number 5, there is a need to invest in women's leadership and support their formal and informal network to contribute to the COVID-19 response. And there is a need to ensure availability of sex and age disaggregated data and analysis for monitoring gender-related impacts of the pandemic, as well as measures implemented to limit this spread. My last slide is a kind of message, and there is a kind of opportunity that is coming up. The UN Secretary General initiative, the United Nations, all agencies, they are going to arrange a food summit in 2021, and the work has already been started. I think that there are two kind of entry points for the country. One is there are 5 action tracks that includes, those are around food production, consumption, livelihood, etc. And there is a country dialogue that needs to be arranged by the country officers or the country leadership. And for that purpose, I think the United Nations Secretary General has requested countries to nominate their very senior, like cabinet level members, to spearhead this whole food system transformation summit. And that will provide actually opportunities to the country to make recommendation and to make proposals so that that can be included in the declaration of the summit. Thank you very much.
Well, thank you very much, Dr. Irshad, for very comprehensively sharing FAO's finding with us, and also the curtain raiser for food system transformation, which of course would be the next mega opportunity. It would be in September 2021. And it is basically opportunity for countries like Pakistan to transform our food systems from farm to fork. So from sowing till consumption, if we, as highlighted by Aamer, as well as the Excellency EU Ambassador, if there are some structural policy inequalities that discriminate against women, I think that is an opportunity whereby we can transform our food systems and we can make it more gendered. Now with this, I'll invite my next speaker, Dr. Pauline Oosterhoff, who is Research Fellow at Institute of Development Studies in Brighton, UK, and she would be talking us through COVID-19 response for equity. So over to you, Dr. Oosterhoff.
Thank you very much. Thank you so much.
Request if you can have about 10 minutes.
Sure. I will keep it short. Thank you so much for inviting me. I am indeed at the Institute of Development Studies. And I would like to talk a little bit more broadly about gender before we are going to zoom in and discuss what has been presented. Let me share my screen. Can you see my screen now? No?
Yes.
Oh, you can. Okay, good. I can't see it on my screen. We're working on a program that has been funded by the Canadians to look at the impact of COVID on gender relations and gender relationships on COVID. To start, I think it might be very useful to first take apart sex disaggregated data, biological markers, and gender. So when you look at some of the research that has been coming out on COVID, you would see, if you look at biological markers, that males and females are equally infected, but male patients get a lot sicker and need more intensive treatments than women do. So if you would look at that, you would say, well, you know, men are more affected than women. If you take a gender analysis, things will look a little bit different. Gender is about the socially constructed roles, the behaviors, the norms that make you a man or a woman or a boy or a girl. And gender intersects with a lot of other markers, as the other speakers already also pointed out, with where you live, your religion, your background, your education, because there's many differences between men and women. and between women themselves. What is really important in understanding the impact of COVID on gender relations is the whole issue of unpaid care. Several of you have already raised it, or the extra work that women already had before COVID, such as making sure that kids get their education, preparing food, taking care of the sick, including these men, taking care of the elderly, collecting water, fuel. And when women are in the labor market and people get sick, they face an impossible choice. Either they get out of the labor market, or the people who need care are not getting the care. And because of all these extra gendered tasks and roles, you will see that women have less time than men, have more drudgery, and that all has an adverse effect on their well-being. Overall, what we can say is that, as you've already pointed out, COVID-19 just puts the clock back for women's rights, their opportunities and capabilities. And a lot of these issues are not highlighted, not in research, not in the media. Women are not often asked, much fewer asked than men, to speak as experts. They speak less often. When you hear a women's voice in the media, it's often having an opinion, not an authoritative expert opinion. COVID plans often don't have any gender analysis, not even gender disaggregated data or sex disaggregated data. And what really is needed is to do better research and to have a better understanding of the impacts. And the research isn't about collecting the data tell you what is happening, but not why it is happening. You need to spend much more time on the analysis in order to have a gender analysis than just collecting some data. As some of you pointed out, there is an issue about building back better, about transforming the relationships that we have, including the gender relationships. To do that, you would need to look at intersectionality and the many different reasons why some people are poorer than others. You could build back to have equality. So then you don't change the distance between people, the power inequalities. You can have equity. You would actually support some people more because their position, their social status is lower. Or you could say, well, I'm going to go for transformation, which means that everyone has the same sort of opportunities, no specific barriers or more transparent barriers. For COVID and for gender, food is absolutely key to all aspects of development, to health, to education, to all the aspects that we can think of in development, the politics of food, for climate change, which is particularly important for Pakistan. It's really key that we are recognizing the roles that women play in all the different aspects of the food system. So their work in supply chains, in the production, the roles that women and men take in production, and the power dimensions in the distribution of food, in the supply chains, the preparation of the food and the consumption of the food, all different steps. I think the question that has been raised about, well, what is going to be the impact of COVID on on poverty and how this poverty intersects with COVID is incredibly pertinent. You will see that many of the inequalities that existed before are now being aggravated. So it's not just about malnutrition, but can we understand who is more at risk of being malnourished? It's not just about poverty, but who is going to be poorer than others, and what do we mean by that, by poverty? And then the question is, well, can research contribute to transforming these inequalities, including the gender inequalities? How should we think about doing this in terms of intersectionality, and what could or should the priorities be? Because we can't do everything at the same time. So maybe we can have a discussion about some of these points in relationship to the presentations that we have heard that went into detail in about the situation in Pakistan.
Thank you very much, Dr. Oosterhoff, for setting the agenda, especially highlighting equality, equity, and justice, and throwing some questions about building back better, keeping in mind the intersectionality of the food systems. We'll come for a discussion, but before that, let me invite the final presenter of today's session, and I'm happy to invite Dr. Aneela Afzal. Dr. Aneela Afzal is an associate professor at Arid Agriculture University in Rawalpindi, Pakistan, and she would be walking us through an impact of COVID-19 on food security and how it is challenging the women. Over to you, Dr. Aneela, and you also have 10 minutes, please.
Okay, thank you, Dr. Abid. Good to hear from wonderful speakers. And Rabia, can you share my slides? Can you hear me, Rabia?
Yes,
SDPI team, yeah.
Dr. Aneela, we can't see you actually.
Sir, actually, I'm going to stop my video because I want you to hear me much better. If that's why.
Yeah, so the quality of audio would be improved if she.
Okay, go ahead.
Okay. Thank you very much. I'm going to talk on the impact of COVID-19 and challenges for women. And as you know, the women are the biggest loser in the COVID-19, and they were the one who lives in the heart of the nature. So all the women are producing food. They are the first ones to sacrifice their own consumption whenever a calamity or pandemic strikes like COVID-19. Next, please. According to WHO, when all people at all time have access to sufficient, safe, and nutritious food to maintain a healthy and active life, and poverty is a state of one who lacks a usual or socially acceptable amount of money or material possession. So here you can see even the definition serve as sufficient proof that food security and poverty are interconnected. If we are able to curb one, the other will be controlled automatically. Next, please. Food security is a world problem and tackled by the government and communities through following measures. Number one, managing food supply through reducing tariff and banning export. And number two, managing food demand by providing aid to vulnerable population in order to make food accessible to them. Can you, okay. Number three, managing food prices by providing direct aid to the farmers in terms of food subsidies and reduce input prices. Now the question is, do these measures work? Unfortunately, not. Not only these measures pose a burden on national exchequer, but also not sustainable in the long run. And as a matter of fact, food security always been considered as an economic problem. And naturally, the government looked for an economic solution to this whole problem. In order to come up with a lasting solution, we need to see poverty in a different social perspective. So when we develop a vulnerable group like women, this is very, very difficult and time consuming, but lasts for the longer. Next, please. Okay. Food security in the wake of COVID-19, the supply chain issues. For some products, Dr. Aamer explained very well. For some products, demand and supply are equal, but produce is unable to reach to the market. In some products, demand has decreased because of closure of marriage halls, hotels, and restaurants, but supply stays the same, putting undue pressure on farm gate prices. So because of the COVID-19, males are coming back from the urban areas and overseas, so decreasing household income and decreasing women decision-making power. So first wave did not hit rural areas, but the second wave is, next please. European Union is spending half of its budget on the food subsidies and agricultural support. And Indian Parliament has also passed National Food Security Bill 2011 worth 18.5 billion to ensure cheap supply to around 75% household. While using these measures, they fail to turn things around. And as I said before, that on the other hand, when a vulnerable group of population is developed, that is difficult and time consuming, but lasts for the longer. Next, please. According to IMF, if the women farmer have access to resources like land, credit, fertilizer, the output can be increased by 2.5 to 4%, which can be much more for developing countries like Pakistan. So giving women farmers more resources could bring the number of hungry people in the world down by 150 million people by the World Food Programme. The sustainable way is the women empowerment. Next, please. In Pakistan, women participate in all agricultural activities, more than 45% in crop production, more than 68% in livestock, and 100% women involved in food production, home management, taking care of elder members and upbringing of children. And they own less than 3% land, and 3% land is meaningless because they have to depend on the male members to operate their farms, and this dependency have a far-reaching impact on their personal life. Next, please. Next. Here you can see in a gender gap index, go to back. Yeah, Pakistan has recorded a precarious gender situation even worse than its neighbors. And the fundamental reason behind this is sociocultural norms, and these norms are already changing, but transforming is quite slow and gradual procedure. And the best strategy, we have to do things like we need to suggest measures that are in harmony with the sociocultural norms. This is very, very important because every culture is unique, but Pakistani culture is very unique in terms of this thing. Sometimes women treat like pearls, but it may be a sweeping statement. I should not talk about it. So most important thing is we need to suggest measures that are in harmony with the sociocultural norms. Next, please. Yeah. I have been working on gender for last 15 or 16 years, and I use a few of strategies or the models which I found very, very successful. Value chain development, creating shared value model, CSV, is introduced by the Michael Porter. And in Pakistan, Nestle used this model and they increased 50% supply, and they gave center stage to women empowerment. Nudging is a very important and very great concept by the Richard Thaler. He received the Nobel Prize on this, and through nudging we can create greater impact through with very, very limited resources. So we conducted in Arid Agriculture University an international conference in 2017 on this concept. And technique of benchmarking, when I was in University of California, UC Davis, I work on the project Poverty Alleviation through Rural Women Empowerment using agriculture as a tool. And it was a benchmarking between Pakistani female agriculturists in Punjab with their US counterparts in California. And technique of influencer is used in a corporate sector very successfully. And we probably first use this technique to impart knowledge. I work with the project of USAID on ICT use of Pakistani young girls in rural farming household. And we use this girl as an ambassador to employ the ICT. So it was a wonderful project, and the great impact of all these strategies or the models. Oh, sorry. Rabia, next, please. I was trying to do by myself. Yeah, these are a few lines from my poetry book. Let's salute the women around the world who give birth to life, who enliven the living with their tender caress, who command the hearts with their soft whispers, and who rule the world with their ethereal beauty. So this is all. I try my best to finish in 9 or 8 minutes. Thank you very much.
Well, thank you very much, Dr. Afzal, A, for remaining within your time, and B, for highlighting very important aspects, and from your research also about the difference in yield and other agricultural outputs, the gender segregated data that you could collect. We have already some questions being posted on the chat box, but before I come to them, let me give this opportunity to the panelists if they have any questions to each other. So first we'll discuss them, and then I'll come to the other questions from the participants. So any question by Aneela or by Pauline for Dr. Irshad for his presentation?
Well, thank you. I mean, those are very rich presentations. I do have a question, and that is for the policy priorities. Could you maybe elaborate a little bit more on how you think these policies could best be implemented? So when we talk about increasing access to social protection for women, what do we mean? Do we mean more scholarships for their children? Do we mean cash transfers? What do we mean by that? Just a little bit more hands and feet, because policies can be quite high level, and the people are living in the real world. So could we discuss a little bit more on that?
Yes, Aamer, would you like to respond to Pauline's question, please?
Yeah. Actually, thank you, Pauline.
You can now switch on your videos. It will be more interactive.
So actually, for the purpose of implementation of policies, I think, for example, if we want to support the productive capacity of women farmers, as I was addressing, especially the issues of rural women, so by ensuring equitable access to productive resources, inputs, and services for the next production season and beyond. So actually, I mean, generally, when we make policies without using any gender lens, so that the benefit goes to the more powerful segments of the society. But when we make kind of conditions, for example, in Pakistan, we have been using the conditions to support the smallholder farmers. So sometimes when policy comes from, or any support comes from the government, federal or provincial government, they say the condition comes that the farmers who has land less than 12.5 acres or in hectares, 5 hectares, they will be getting benefit from this policy. So similarly, with regard to women, focusing on women and empowering women, the policies can come with these conditions that this benefit of policy will be to women or to like women household in charge if the beneficiary farm or beneficiary member is a woman. So that is a kind of way we can ensure that the benefit reaches to the woman instead of reaching to the men or the more powerful members of the society. Thank you.
And Pauline, it's in the context that we don't have universal social protection in Pakistan. So if you have it in that context, I think that's where from where Dr. Aamer was trying to highlight the more gendered responses, policy responses. Any question for Aneela from the panelists? Aamer or Pauline, do you have any question for Aneela?
No, I'm good. I'm good.
Pauline, your mic is off.
Sorry. Sorry. Yeah, I do have a question. It's about transforming gender relations versus equality and equity, and how you see nudging into this. Like nudging can help people access what is available. It seems to be not so suitable for great transformations, because it's focusing on the things that we can do relatively easily. But maybe you see that different. Maybe you see ways of using nudging to work on transforming gender relations in food systems.
Aneela, your mic is off.
Thank you. Actually, gender is a tricky business for me. And there is not a quick fix solution for some things. And international experience shows that modernizing agriculture may or may not produce desirable results for women. So when we talk about the Pakistan is one of the largest charity giving nations. So it won't make sense men deprive their families when given additional resources. Ultimately, they spend money for the household income and like education, health facilities, the better health facilities for the family members. So women are not in a marketing in Pakistan. They have no role in production. They have they participate in more than 70%, but not in marketing. Nudging is through this concept we can create awareness. We can create like we don't need much resources for this, and we need to change the human behavior. It's quite a difficult procedure, the difficult thing to change human mind. So something looks very nice on the paper, look fancy, but implementation is quite difficult. So nudges, I like this theory and work on it. My 2 PhD students are working on this, and we are looking some great impact or stuff. So I think we can do things and suggest things again in the harmony with the socio-culture norms.
Thank you. Rashid Sab, do you have any questions for the 3 panelists here? Your mic is off. Rashid Sab, yeah.
Thank you, Dr. Abid. Can you hear me now?
Yes, yes.
So not really. I think it was a very fruitful afternoon. So hearing all the panelists and talking about the areas they chose to talk. My only worry is that we are entering the stage of and that's true of all pandemics. So we are wiser about pandemics once they've come and almost gone. So, and that's a lesson about
So
pandemics.
I will come to your comprehensive comments, Rashid Sahib, if you just allow me to throw a couple of questions which are posted here on the chat box for the panelists.
Can you hold on, Dr. Sahib?
Yes, sir. Yes.
So you invited me and then you cut
Yes,
me
sir.
short.
Actually, I wanted to have your comprehensive concluding remarks. So I have a couple of questions on the chat box that I want to pose to the panelists, and then I'll come to you.
Can you let me finish it?
Yes, sir. Yes, sir.
Thank you very much. So I think there are one or two areas. I think there was this one remark, and I think we need to be very careful about that. That was Pakistanis are probably the best charity giving nation. So I think this is one of those myths that we have enjoyed to live with. There's no data that supports it, and that's not correct either. Secondly, I think while this is very important that we are talking about all these three areas, and I'll give you my own review at the end. But my request, Dr. Sahib, to you would be that there is going to be a great issue with respect to gender and poverty and equity when eventually the vaccine now comes in, which would be probably the next year. So probably it's high time that we start talking about that now, rather than concentrating energies on which is already almost a closed transaction as far as pandemic's initial, first wave and second wave is concerned. So even if we come up with a better policy matrix or a better implementation mechanism, it wouldn't be, it would take quite some gestation time to implement it. So while we might be wiser about the next pandemic, for this one, probably there's not much room for course correction on the basis of the a very wise, views that I've heard today. Thank you.
Thank you, Rashid sir. I have a couple of questions here on the chat box, and also Dr. Alia wanted to ask a question. I don't think we can take live question, but Dr. Alia, if you can write it here, I'll ask it to the panelists. There's one particular question for Pauline, and Pauline, it is about, can you please elaborate health burden due to malnutrition? There is one question for all panelists, whoever would like to respond to them, and that is what government is thinking about green recovery and what are the gender related responses by the government. I think I'll request Rashid Sahib to throw light on when he gives his concluding remarks. And then there is another question, and that is about striking, and it's quite striking that the highest level of malnutrition are in the areas of high agriculture production. This suggests the problem is more a function of social inequality, something that EU ambassador was also pointing out. So Aneela or Irshad, any one of you would like to respond to it. So I'll come to Pauline first.
Sure. So the question is what the health burden is due to malnutrition, isn't it? So due to malnutrition, you would have wasted growth, stunted growth. So less development of muscles and muscular systems, but also children will be smaller, stunted. It has an effect on the development of the brain, and that then affects your ability to learn. When people are malnourished, they're more vulnerable for all sorts of diseases, physical diseases, diarrhea, it's a vicious cycle. And malnutrition is also linked to depression. So when people are not eating enough. They are listless. They might feel not a lust for life, not able or willing or interested to take initiative. And these initiatives, this desire to do things, to change things, to improve your own life is really important for your health and is a consequence of health, as well as an outcome. So these are some, there's a lot of literature available on the topic in Pakistan as well as at the global level. And I'm sure there's wonderful lecturers here that can give you the specifics for Pakistan.
Thank you. Irshad, would you like to educate us about this whole issue of social inequality, the striking fact that more malnutrition is where more production is?
Dr. Saab, I think that is, I heard this discussion. I mean, even at UN country team level, that point was made by somebody. But I mean, that in my understanding, I mean, that indirectly, if somebody makes this statement, that tells that the farming is not a solution for food security or food insecurity. So my understanding is that, I mean, the food is linked to the farm. And if there is a farming, there's a food production, there is less likeliness that the people in that specific area will suffer food insecurity. So I think maybe that is a kind of observation, but that is not supported by any evidence. That is, you know, my understanding. I didn't see any study, structured analysis or evidence in literature, but these are the kind of observation I heard in several meetings that, I mean, while traveling in Pakistan, some colleagues, they have observed that where there is a farming, there is agriculture activities going on, they observe the food insecurity or malnutrition in those areas. But generally, in my understanding, that doesn't make much sense if we understand that the food comes from farming or from the farm. Over.
Maybe Rashid Saab would like to shed more light on it. Rashid Saab, you see, many of the reports by World Food, many of the reports from World Food Program, they actually highlighted the food insecurity prevailing in South Punjab, which seems to be, which of course is our food basket. Now, Aamer Saab's argument is that perhaps food security cannot only be ensured through the production, but this whole question of social inequality vis-a-vis food production and malnutrition. So would you like to give your take on it?
Dr. Actually, there is a case that if there is good farming going on in South Punjab or even say Upper Sindh, and if the land distribution is such that a lot of people are landless, and over time mechanization has, you know, kind of made people the labor less, you know, less labor dependent, such agriculture, then there would be a case that the non-farming or non-land owning families in those very areas, there's a lot of food production is taking place, or, you know, best of the sugarcane crop is taking place. But those are big farms, and, you know, South Punjab has bigger farms than Northern or Central Punjab. So there is all likelihood. I haven't seen any data either, as Aamer has put in, or a structured analysis on that. Do I have been hearing things here and there? But I wouldn't be surprised by that. So there is a case for actually people underestimate the number of people who do not own land in rural areas. That percentage is very, very high, appallingly high. They still live in rural areas. So the regions of the country which have not moved towards industrialization, they have not been able to provide jobs to those people who do not own land. Resultantly, their poverty levels are much higher and access to food is much less. So, I wouldn't be surprised on that, Dr.
Thank you. Probably, I think their question, it originated from a couple of reports that World Food Program, they produced food insecurity in Pakistan 2003 and food security in Pakistan 2009, where the ranking of southern districts of Punjab, it was one of the worst food insecure districts within Punjab. So I think maybe the question originated from them, but you rightly pointed out that perhaps we need updated data to now support this argument.
I think this issue of ending poverty, no country has ever ended poverty by improving agriculture alone. Ending poverty is a function of bringing labor outside the agriculture into non-farming professions. This has happened in India, this has happened in Europe, this has happened in the United States, this has happened in Canada. I'm not saying that there shouldn't be emphasis on agriculture or food production. That is one thing. But much less number of people actually should be engaged in that activity, and more people should be doing non-farming jobs. That's the only path that the world has seen in reducing poverty at significant levels. So for example, China has brought some 800 million people out of poverty in less than, say, 30 years. So that revolution is essentially not by increasing per acre productivity in the rural areas. It is essentially by bringing the labor outside the farming sector into non-farming jobs. So much so that now actually China is subsidizing its agriculture from non-agriculture sector at a massive scale. So we were just looking at some of the Chinese state level and national level data on how much money is being spent on agriculture promotion. And that comes from something like $1,500 per acre. So that's a huge investment. So this money is actually coming from other sources, and Chinese state is cash-rich state. We know that because they have been able to control the consumption levels. So the path to more equitable access to food does not go through agriculture alone. I'm not saying we shouldn't be emphasizing in agriculture. We must be, and more productivity is needed, vertical growth is needed, etc., etc. But the path to this part is going to come from some essential rural industrialization programs where we are able to take industry to the rural masses. We are able to bring smaller towns where the labor moves and then works in, manufacturing or, services sector. So I think that's my general view on that.
Dr. Saab, if you allow me a very quick point, just to emphasize what Rashid Saab has mentioned. If you see the economy, rural economy of the country, you will see that the more people are engaged in the farm side of the economy compared to the less people engaged on the non-farm side of the economy. But the non-farm size is bigger than the farm side of the economy. So as Rashid Saab has very rightly mentioned, that to bring change in the rural economy, rural setting, bring people out of the poverty, is very much needed that the government fix something to bringing people out of the farming sector and put them in the non-farm economy. I mean, that will a kind of a way to you can bring a change, and that is a solution. The other country, I mean, the economic curve or the development curve follow actually the same path. You need to bring people out of the agriculture sector. Over.
Well, perhaps we can discuss it in the broader discussion of food systems. But Dr. Aneela, Afzal, before I come to Rashid Saab for his concluding remarks, would you like to add anything in the discussion?
Thank you, Dr. Abid. That's fine. That's okay. You can conclude.
Thank you. Pauline, would you like to add anything on what you heard so far? Any final point from you?
No, I do agree that gender relations are really very tricky, and I think what's important is to look at both the high-level policy and then how it gets translated to the household level, and at each of the different levels you will find opportunities for transformation or reinforcement of inequality.
Thank you, Pauline, and that brings me to the final segment of this session, and the final segment is requesting Rashid Saab to summarize, to respond to some of the issues raised by the panelists. And of course, one thing that is coming again and again in this discussion is, do we have any proper strategy to deal with this new nexus, COVID recovery that you mentioned in your earlier comments, gendered distribution of vaccines, etc. So COVID recovery, food insecurity, and the systematic inequality and inequity that persists in our system against women. So over to you, sir.
Thank you. Thank you, Dr. Abid. First of all, on behalf of the Minister Saab who couldn't be available here and Secretary who initially was planned to be here. So I thank you, yourself and your team who have been able to organize this webinar on such an important issue. And first of all, I have learned new things. So I'm thankful to Her Excellency EU Ambassador, Androulla Kaminara. I'm also thankful to Dr. Pauline Oosterhoff and Dr. Aneela Afzal for their contribution to the debate. And I'm also thankful to our own Aamer Irshad, who is our man in the FAO, and who has very diligently put up his slides and kind of provided us the perspective through which we could see. I'm also thankful to the message that was shown and displayed from Ambassador of the Kingdom of Netherlands. And I believe the embassy has also probably kind of joined hands with the SDPI to organize this webinar. So we are thankful for that too. As far as government's response on COVID has been concerned, so a few words on that. I think already it has been pointed out that government came out with a big package, 1.25 trillion rupees, and of which 56 billion rupees were only targeted towards agriculture. But more than that, if you look at the rural sector or the agriculture sector, so you would see that our national socio-economic registry data, which is under Benazir income support, that was used to funnel roughly, Dr. Aamer would correct me if my figures are not updated, but that's more than 150 billion rupees. Aamer, is that correct?
Yes, sir, that's correct.
So that was a big money that actually went into rural sector. I tell you, while this package came as a relief to the COVID, and we must understand that pandemic is essentially an urban shock. It's a rural shock, yes, but it's much more than that. It's an urban shock. So when, the government was designing this intervention to provide, relief to the families, we had no other vehicle to implement it except Benazir Income Support Program and the National Socio-Economic Registry. Now, National Socio-Economic Registry somehow is skewed towards rural areas. So 80% of the households in the National Socio-Economic Registry are actually in the rural areas. There are other problems with the registry too, updation issue, because this is an old data, 2010. So they're both inclusion and exclusion issues. But this is the best we had at the time when this money had to be funneled to reach the households. So while maybe the relief could not be provided to the urban households who lost jobs because of COVID in the first wave, but a lot of money actually went into the rural areas because of the nature and type of the data set that we were using, the National Socio-Economic Registry. So I think that was big money that went into rural areas. But if you look at the agriculture sector alone, and if you look at the data of, say, whether the wheat production was affected by COVID, probably not. So whether the crop of the sugar cane was affected by COVID, probably not. There are other factors because of which, cotton was affected, other crops were affected. So rural area actually has a resilience towards pandemic, much more than the urban jobs have. So in that sense, rural communities, though they always suffered more inequity in sense of more, less access to the food and nutrition, which is well documented and which, our worthy speakers have talked about. So as far as this COVID response was concerned, I think it was extraordinary geared towards the rural areas. So while there were, also money that was channeled to the industries and manufacturing units and tax breaks and subsidies and, relief on electricity bills, et cetera, to save jobs in the urban areas. But in urban area, honestly speaking, the biggest thing that the government was able to achieve was not through kind of these backstop interventions, but because of government's very proactive policy of understanding COVID in the right way and then implementing smart lockdowns over time. So while a lot of credit is not given to the government for that, I think despite being in a region which is very, very similar to India, to this day, our record on preventing losses to life or losses to the economy has been much better than our neighboring countries. We wish they would have also fared much better. And I don't know how the future, what future holds for it, but very early realization and better coordination mechanism at the federal level did indeed help avoid some of the spread to the smaller towns and medium-sized cities. So in the first wave, actually only the larger cities like Islamabad, Karachi, and Lahore were really affected. If you would go to Gujranwala, you would hardly find a case. Though in second wave, we are now finding more evidence of this traveling to Multan and places like Gujranwala. But still, small towns and rural areas are largely free of COVID. So we must remember that the incidence of the disease itself is very uneven, and it's affecting more, mega urban centers. While our relief activities have not, we couldn't tune that because we do not have those data sets or, you kind of say national documentation of households where we could have targeted these subsidies or government interventions exactly, and there are implementation capacity or capability traps issues that we always talk about. So honestly speaking, Pakistan has been largely, kind of spared of, we had another recession that was already going on. So there are problems. So we mix both. But as far as COVID response has been concerned, on prevention side, I think it has been pretty good. Of course, when we look back at data someday, and we would like to put some causation on whether the poverty level went from 24% to 33%, whether that was because of COVID or otherwise the ongoing recession, it would be very difficult for researchers to disaggregate the two. My hunch is that this is not because of COVID to this day. I do not know about the future and how the pandemic takes the turn. But honestly speaking, problem with our discussion today and governments around the world is that we are using existing frameworks, both mental as well as academic, to analyze COVID. COVID is a totally different ballgame. So let me say that even the international organizations and the first world countries. So a friend of mine actually based in New York, he's an economist, and he called one day and he said, can you connect us to, the people who are doing the policy work and we can contribute a lot. And I said, I would have definitely, if, where you are based, they would have done much better on COVID. So, so while we used to look up to United States and other Western countries to seek, advice and international best practices, as is well known in the development literature, here, honestly speaking, international best practices probably are not coming from the regions where they used to come from. So COVID is a totally different ballgame. And I think as a race, we have to see this rise of this new age of pathogens in a different way. So this is not the last time that a pandemic has hit. It's going to be very frequent phenomenon. So the literature on pandemics had been very clearly saying since 2000, they were crying out that, and people in, even in WHO who were working on preventing pandemic, they were crying out that the world needs to be more diligent about, but they wouldn't get even a table on the, they wouldn't get even a place on the table, to discuss this. That reminds me, there is a school of public health in Boston, United States. And there's this Harvard Medical School. There is a Harvard School of Public Health there, and there is Harvard Medical School. So if you go to both schools, and maybe some of you would have gone to one of them, you see these buildings totally differently. So if you go to the building of the School of Public Health, it's like a dilapidated condition building, looks like from third world country. And if you go to Harvard Medical School, it's like lush, posh, great, sexy building and everything is so trim and plank. So what I'm saying is that world has not been giving resources to the community of people who have been working in preventive healthcare. Just imagine, we do not have, our best talent has not been going towards that area. And unfortunately, because of the human footprint that has gone into those niches of areas where the interaction between human beings and the nature has increased manifold, particularly in last 30, 40 years. So the probability of pathogen traveling from animal and plant kingdom to human kingdom has increased manifold. And unfortunately, international health system, our national health systems do not recognize that problem. So my worry is that we probably would have some kind of a pathogen every 10 years now. So, and we wouldn't be ready. And it's much less money that needs to be invested in preventing that from happening than actually trying to then, build resilience and try to kind of compensate for the effects of COVID. So if really a good discussion, Dr. Abid, I would suggest to you is there are two areas on which I think we need to kind of have more discussion and bring more people through your August forum. And I'm really thankful to you. This is a job that public sector bodies should be doing, but you're doing a great job on that. One area is this medium-term to long-term preparedness of public health system for this kind of new age of pathogens. And secondly, in immediate future, there is going to be this great unequal distribution of vaccine throughout the world. So I think we would be challenged in our fundamental ways. So if you look at this, it would be a challenge for development community. It would be a challenge for UN system. It would be a challenge for kind of global morality that we had assumed had started to exist in the world. So the vaccines would go to the first world countries, look at Canadian government. They have kind of made contracts 9 times their national need. So that is essentially crowding out the countries who do not have enough money to. So this is, I think, where some of the advocacy focus of the international organizations and our diplomatic community who work here, that must go. That there's no point in buying 9 times than your national need. Then essentially you're telling companies, hey, here is a buyer who is ready to kind of lock orders of this much, and here is a poor country like, say, Sri Lanka, Pakistan, Bangladesh, or a country from Africa. So their chances of locking these orders and getting these supplies would diminish in a big way. So I think on an international level, we need to do that. And secondly, even when the vaccine arrives in this country, there would be a lot of inequity issues, how it would be distributed. So I think we need to work on that. And before we get the vaccine, maybe we in the government as well as in the development community, we need to reach a formula whereby we are very sure who is going to, a vaccine, would be distributed maybe over a year, but who gets in the first month and who gets in the last month has to be based on public health principles rather than who has the ability to, kind of game the system. So these are two areas. I'm really thankful to all the participants for being part of the webinar, and particularly Dr. Abid for being with us. Thank you.
Thank you. Thank you very much, Rashid Saab, for excellently summing up the discussion. As I said in the beginning, that food security in itself, it's a transdisciplinary concept, which got even complicated by this pandemic that no living person among us has seen in his or her lifetime, and then how they would be affecting women and how to actually safeguard women from the impacts of it. That was quite complicated discussion, which of course cannot be summed up in 90 minutes, but I'm extremely thankful to the 3 wonderful speakers who presented their research findings, to the 2 diplomats who shared their support to the cause, and for Rashid Saab for joining in, taking up this recommendation and to the right circles where it matters. In my own capacity, I'll definitely try to take this recommendation to the highest forums where it matters, both in Economic Advisory Council of Prime Minister as well as to the Food Security Advisory Body in the Strategic Planning Cell. So it's a collective effort. When Rashid Saab was talking of this discriminated procurement of vaccines, it reminded me of this very famous saying, and I'll conclude it on that, that money is yours, but resources belong to humanity. And we need to ensure that through your money, you don't capture all the resources. And that is what, when we talk of sustainable development, and sustainable development in the times of COVID is much broader than what we have been discussing. So thank you very much for enlightening us with your expertise. And I look forward to host you in the next 3 plenaries. We will have a plenary with the Governor State Bank and the Federal Minister of Industries and Production at 4 p.m. From 4 to 5:30. Then we have a plenary with Dr. Irshad Hussain, Federal Minister for Institution Reforms at 6 o'clock. And we have a plenary with Dr. Moeed Yusuf, who is Special Assistant to Prime Minister on Economic Outreach and National Security, where we will be discussing economic security in the times of COVID. So I would request all the participants to keep logged in and do join us for those plenaries. Thank you very much again.